Good afternoon. Good afternoon to everyone. Can I invite everyone to gather a little bit? Every time they open the door, it gets very cold, so we need the warmth. We have here some of the speakers for today, but I want to welcome everyone to this very special ceremony where we're going to place the HSPH time capsule in a place where it will reside for the next 50 years. We are joined in this event by Lord and Lady Crisp, because I thought they were in town, and I thought I would bring, two representatives of a society that really values tradition. Nigel Crisp is a member of the House of Lords, and that's an institution that makes our 100 years look like a very, very short time. But welcome, and welcome to all of you who are members of our community. Now, some of you may or may not know that there is an international society of time capsules located at Oglethorpe University. As you know, this university is in Atlanta, Georgia, named after the founder of the state. And this society, the Society of Time Capsules, studies and catalogs the existence of time capsules. And according to the society, there are more than 10,000 time capsules in existence around the world today. I bet you didn't know that. I didn't know that, but now the university is also the site of a famous crypt of civilization. The crypt is a swimming pool-sized chamber that includes thousands of pages of microfilm material, hundreds of newsreels and recordings, and memorabilia as varied as a set of Lincoln logs and a Donald Duck doll. It was officially sealed in 1940 as an attempt to preserve salient features of civilization and that existed at that time in 1940. Now, this crypt is not supposed to be open until the year 8113 AD. So, I mean, these were clearly optimists and who hadn't heard about climate change. But, they assume there'll be someone to open the crypt in 8113. Now, obviously, our time capsule may seem quite modest by comparison. Certainly, the timeline for opening is way shorter. But the underlying purpose of our time capsule is quite similar. We want to give future generations a sense of our HSPH culture in 2013, 2014. And so, as many of you recall, when we launched the centennial celebrations at the beginning of our academic year in last September, each department at the school was asked to contribute something to the time capsule during our centennial celebrations in the fall. The contexts are characteristically varied. As you know, we cannot get the 9 departments to do anything the same way. So characteristically, they contributed very different items. For example, the Department of Health Policy and Management contributed some academic policies, as you might expect. The Department of Nutrition dug into some of the seminal pieces of research. Environmental health reflected on the enduring nature of a public health problem. With this contribution, they contributed 2 doctoral dissertations, dated exactly 90 years apart. One was written in 1923, the other in 2013, but both are on the same topic of lead poisoning, just showing how enduring some public health problems can be. Global Health and Population contributed a booklet from their own 50th anniversary symposium, which, as you may recall, took place in the spring, and so on. I mean, it was a very varied set of contributions. Then we had contributions from students. The student government president, Germán Orrego, wrote a letter to his own successor. There are also documents from administrative departments that paint a picture of how our school operates today. There's a financial overview from financial services. I just can't imagine what's going to be the reaction in 50 years. There's a curriculum guide from the Office for Education. Then the Office of External Relations placed a copy of our booklet, which is the campaign case. just to show what we were raising money for in 2013 and 2014. I included a copy of the Lancet report on health professionals for a new century, and actually Lord Crisp was a member of that commission, which describes the conclusions of an international commission that I co-chaired, recommending how we believed, at the time that was published, that education for health professionals should be in the 21st century. I'm sure it will be very interesting for some of you who are here and are going to be around in the next 50 years to see how many of our recommendations were actually followed 50 years hence. And then at our big celebration in October, on October 24th, 25th, you students, faculty, and staff also added dozens. If you remember, we had the birthday cake and all of that. The crypt was, the capsule was I'm upgrading it, was open, and you contributed dozens of handwritten notes on paper, business cards, even currency from your different countries, even paper plates. Then we had alumni weekend, the following weekend, and alumni inscribed messages on posters that are also included in the time capsule. The fall centennial celebration itself is commemorated because we included the knife that we used to cut the school's birthday cake. We didn't include a piece of the cake because we feel it would be stale by the time this is open, but the knife was included. And a lucky HSPer in 2063 will have a chance to wear one of the coveted centennial hats, which is here for whoever wins that award. So now we are preparing to close the time capsule. We're going to put it into the wall for safekeeping for the next 50 years. And as we do that, we thought it would be very appropriate to ask two of the younger members of our community to present their vision of what they believe the field of public health and Harvard School of Public Health will look like in 50 years when the time capsule is open in 2063. After all, it is unlikely that I am going to be around 50 years from now, although I have to say that my grandmother lived to 106, and if I inherited some of those genes, maybe I'll be around. But it is unlikely. But I certainly hope and expect that many of our junior faculty members and many of our students will be around to witness that day when the capsule will be open in 2063, and that you will be able to tell those folks something about those who were here today in this ceremony, and we're recording it, so unfortunately we won't be able to put the tape inside the time capsule because then no one would be able to tape that, right? So, but there will be some record of our proceedings today. Our first speaker is a young faculty member who was hired to join the faculty during our centennial year. So I'd like to invite Cristina Roberto, who's an assistant professor both at the Department of Social and Behavioral Sciences and in the Department of Nutrition, to come up and give us her thoughts about what the future might look like. Cristina.
So thank you so much, Dean Frank. It's really wonderful to be here. I'm delighted to be participating in this historic ceremony. So as Dean Frank said, I've just started as an assistant professor, and I was honored to receive the invitation to speak today. And I was told that my remarks should, quote, illustrate what you imagine the field of public health to be like 50 years from now in the year 2063. Well, as we stand here as part of the Harvard School of Public Health community, I think the question is not, what will the field of public health be like? I certainly can't predict that, but rather, what do we want it to be like? Because just as Harvard has been a leader in shaping public health's past, we can lead in shaping its future. Of course, we all have many aspirations for the future of the field of public health. I'm going to focus on just one aspect, the way we conduct and communicate research. The goal of public health is obvious, to make the public healthier, to do research that makes a real difference in people's lives. And although the field of public health is already achieving this, I believe we can make an even bigger difference. Right now, one of the greatest barriers to improving health is the gap between academic scholarship and policy. To address that gap, to make a real difference, we need to ensure that we're using our skills and resources to answer the right questions, the questions that policymakers need answered to make people's lives better. Traditionally, scientists ask research questions that other scientists think are important. we don't usually consult people who are in a position to enact change, like policymakers, lawyers, advocacy groups, or companies. So how do we figure out which questions policymakers want answers to? Well, we should ask them. So to have the most impact on people's lives, we should talk to people who are actually in charge of designing and implementing the policies we care about, so that we can do research that enables them to create policies that work, that are based on evidence rather than a hunch or a gut feeling. Of course, there's an important role for traditional scientific work where questions are generated from curiosity alone, but there's also a strong need for strategic science, for asking relevant research questions that would provide policymakers with the data they need when they need it. So my introduction to the idea of strategic science happened when I was a first-year graduate student. My own work focuses on obesity and nutrition and food policy. And at the time, New York City had just announced a new policy that they were going to put calorie labels on restaurant menus. And I was struck by something. This policy was being proposed, but we didn't have any data on it. Would it influence behavior? Would it backfire? Is there a better way to do it better? Is there a way to do it better? And so here I had this chance, I'm this young graduate student, and I had this chance to use my newfound skills as a psychologist to study a policy issue that was badly in need of empirical data. I ended up conducting a randomized controlled trial of calorie labels on restaurant menus, and I did find that it impacted behavior. The presence of calories did cause people to eat fewer calories at a meal. Now, if I had been training in any other psychology department, this story probably would have a different ending. It would end with me publishing the study, and if I'd done a really good job, I'd land it in a top-tier journal, and then I'd move on to the next project. But I was particularly fortunate because I worked with a mentor at a place that strongly valued applied policy-relevant work and communicating science to policymakers. And so before the study made its way through the long publication process, my mentor, Kelly Brownell, was down in DC, and he tells this great story of having the data, it hasn't come out yet, and he's got these Congress people huddled around him, and he's drawing our bar graph on napkins, and they're getting all excited because it's directly relevant to what they're trying to do. And so because of that, ultimately they found the data helpful and actually used it to inform the policy. As a grad student, this completely blows my mind. I just feel totally inspired and motivated. But it didn't just happen. Several things had to be in place. First, I was supported to do non-traditional applied psychological research, something that's more common in public health, but relatively rare in psychology and many other disciplines. Second, I was working with a mentor who was committed to communicating those findings to policymakers, and I had the support of a communications and policy staff that would get our science out in the media and to staffers on Capitol Hill. Third, I had the funding and structural resources to carry out an ambitious project relatively quickly, and I didn't have to apply and then wait a year or two for grant funding. But this environment is the exception rather than the rule. Without all of this, we would have missed an opportunity to connect science and policy. So this was a big aha moment for me at the time. Ask the right empirical question at the right time and communicate it, science can influence policy. This is just one small example of strategic science. There are many across public health, but over the next 50 years, I envision this kind of strategic research happening across many more disciplines, with public health leading the way. Policymakers want to make effective policies, and schools of public health can help them to figure out how to do that best. I feel exceptionally lucky to be able to continue this kind of work here at Harvard, as no school of public health has contributed more to our understanding of nutrition and obesity, and no school has collectively produced scholarship that's had a greater impact on nutrition policy. But in 2063, I imagine some important changes at Harvard and other schools of public health. I imagine a more streamlined research process. Right now, it can take years for a study to go from conception to funding to publication. The publication process alone can take a year or two. Envision that changing. First, conducting strategic science that is responsive to immediate needs of policymakers requires a different approach to funding. It requires more rapid access to funds that would enable scientists to ask policy-relevant questions and carry out that work in a timely manner. And it will require an emphasis on funding teams of investigators that include scientists partnered with policymakers and communication experts. I imagine frequent conversations and ongoing relationships between scientists and those in positions to enact change, so that research questions are generated collaboratively and findings are relayed quickly. I imagine schools of public health hiring more people with hands-on experience working in policy, advocacy, and legal settings, and hiring more people with practical communications and marketing experience. If we don't effectively communicate our science to policymakers will ignore it. And if we're committed to having evidence-based policy, then scientists at all stages of their careers must be trained and incentivized to communicate more broadly through the media, policy briefs, op-eds, FDA commentary, and direct conversations with those in positions to create change. And schools of public health must have an infrastructure to support this kind of communication. So 50 years from now, when a new group of people is crowded around this exact spot, waiting to unveil the contents of the time capsule we bury here today, I don't know what the pressing public health needs will be. I don't know what new technologies will be changing the landscape of public health in the world. What I do envision is a strategic approach to the way we ask our research questions and communicate the answers. I envision a field that is answering the most useful questions at the most crucial times to give policymakers the knowledge they need to best improve the public's health. Thank you.
Thank you, Christina. The future looks bright. Our next speaker has the perfect last name to speak about the future. Rebecca Hope is a member of the Centennial class of students. Assuming, as I'm sure will happen, that she continues to perform excellently in her studies, she will receive her MPH with a concentration in global health this spring and will be part of the Centennial class. So we will now hear Rebecca's vision for the future.
Friends, students, and teachers, welcome everybody. We've arrived almost at the moment where the time capsule from Harvard School of Public Health Centennial Year will be sealed until 2063, 50 years from now. And I see a lot of you here tonight from the Centennial Year graduating class of 2014. And I hope you know that you're all invited back here in 50 years' time with your walking frames and your orthopedic shoes to remember our time together and celebrate our achievements in global health. And I think, hopefully, if we've been really effective in our work, 80 years will be considered middle-aged, and we'll be having a good party. Will the next 50 years have changed as much as the last 50 years? When I think about the last 50 years of health, I think about my grandfather. He contracted polio as a child and spent almost a year in Liverpool's Hospital for Tropical Diseases. Despite being told he'd never walk again, he recovered eventually and went on to run a marathon, cycle a tandem around England with my grandmother, and live a healthy life. It seems unbelievable now that a disease on the verge of eradication was such a real fear for many parents, families, children. We've come very far. And as Dean Frank reminds us, the average life expectancy during the 20th century increased by 30 years in the US, with 25 years of that increase thanks to improvements in public health. Clean water, vaccines, and decreases in cigarette smoking. Globally, huge improvements in living conditions, nutrition, health interventions like safer childbirth practices, the eradication of smallpox, near eradication of polio and guinea worm have dramatically improved human health and well-being. But newer challenges have arisen over the same time periods. The HIV epidemic, an explosion of obesity, heart disease and cancer, increases in natural disasters and complex emergencies. These two are being met with greater innovation and coordination from the public health community. New technologies have made a huge contribution to lives saved, thanks to work over the last 50 years by incredible scientific minds, many of them here under this roof. There are far fewer diseases for which we lack effective treatments and prevention strategies. But our real and pressing challenge is to find the ways to improve access to these treasures. So I wonder if over the next 50 years the emphasis in public health will shift. Resources for medical and public health services will most likely remain limited in much of the world. And so perhaps the focus will by necessity be less on developing the next new medical technologies, but on making them available to many. To gain the kinds of improvements in human health experienced in the last 50 years, we will have to focus more on being creative, effective, and caring in our implementation of what we already know about how to improve health. There's one remarkable asset to help in achieving this endeavor: people. I believe what will save the next in the next 50 years, save the most lives of the daily service of people, people like you imaginatively deployed to prevent human suffering. Volunteer health workers who travel across muddy roads to deliver healthcare to their communities. Nurses and doctors effectively deployed in delivering the right level of care, not the type of care that makes them the most money. The volunteer on the end of the phone talking to someone who feels desperate. Volunteers sitting in healthcare clinics offering peer support to other young people. It will be human kindness, brilliantly used, that will continue to improve the health of millions in the next 50 years. Harvard attracts, nurtures, and cultivates leaders. Yet what is most impressive about the class of 2014 at Harvard School of Public Health is their motivation aptitude to lead through service. This year's class contains many such leaders. Students here are finding ways to improve access to healthcare for women in rural Kenya. We're using technology to train doctors in Palestine across geographical and political borders. We are coordinating healthcare for refugee populations from Syria, like our colleague Arash Beazin, who has since had to interrupt his studies temporarily to return to this very urgent work. I could list many more, but I would need all evening, and we've got a reception to get to. I see incredible promise among our graduating class. There are dengue scientists, health systems analysts, statisticians, future ministers of health. I think you know who you are. Indonesia, Sudan, Argentina are going to be very lucky in a few years. We've got gender experts, economists, surgeons, pediatricians, environmental scientists, innovators in technology, M-Health, dedicated health workers, and humanitarians. You came here this year from hospitals and health centers across the world, the military, the United Nations, NGOs, refugee camps, animal hospitals, art galleries, NASA, to perfect your public health service and contribute to life at HSPH in this centennial year. You are the people who will shape the next 50 years in public health. You are the people who will finally work out how to make sure that everyone who has HIV has access to antiretrovirals. You are the people that will see to it that all the children, whether they live in India or West Virginia, have access to healthy food to eat so they can grow into healthy adults. You are the people who will figure out how we can effectively coordinate health services amid war or following floods or natural disasters. You are the people who will determine how to mitigate air, water pollution, and the effects they have on our health and our planet. So like the world, HSPH will be very different in 2063. Hopefully we'll spend even more of our academic time learning in real-world classrooms, studying public health issues up close, and getting the chance to innovate in real time under the guidance of our professors. But what won't change in 2063 is the essential character of the students, faculty, and staff here. This will continue to be a place of brilliance, where smart, diverse, but engaged students and faculty can put friendships into partnerships, ideas into solutions, and passion into practice. I believe over the next 50 years, our grand challenge is not just to produce the next new technologies, but rather to innovate to ensure the solutions and technologies we already have serve the many and not just the few. We must harness the power of people, families, and populations to help them to foster their own best possible health. We must lead through service, innovate to cover that last mile, deliver the promises of technologies that yet wait to be fulfilled. This is our task. The passion, intelligence, and dedication collected tonight in this room make me believe that this is a very possible task. Like many of you, I arrived here at HSPH seeking to achieve these skills, to find my own way to contribute to improving human health. And I remember at the beginning of the year the speeches that we heard that our fellow students would be our greatest teachers. I'm very proud to be able to have shared this short but precious time with you all. Not only have you been patient and brilliant teachers, but also compassionate friends, guides, and mentors during this journey. So I wish everybody all the best in the future with everything life brings over the next 50 years. And thank all of the students, our dean, my supervisor, Paul Campbell, and all of the incredible staff and faculty members who've made this centennial year so memorable and important for all of us. So I'll see you in the next 50 years, if not sooner. Thank you.
Thank you, Rebecca. Well, there you have it, Christina and Rebecca, the voice of the future. So, enclosed in this box is a letter from me to the school's dean in 2063. I read it in October, so I'm not going to read it now, but I just want to say one thing, recall one thing that I write there, something I tell my successor. And it is the idea that each generation has one overriding responsibility, and that is to safeguard the legacy it has received from previous generations and hand it enriched to the next one. It is my fervent hope that when you, young faculty members and students, return to celebrate the school's sesquicentennial, you will conclude that my generation has lived up to this utmost obligation. So we now prepare to put this time capsule into the wall for a half century. Like the crypt of civilization, this bit of our Harvard School of Public Health culture in our centennial year will now be preserved for succeeding generations to ponder. Let me invite Academic Dean David Hunter to help me lock the box and place it in the wall. David? I'm not going to swallow it. That was very heavy. Thank you all for being here on this happy occasion, and you're all now invited to move to the FXB atrium for a reception. Thank you.